Hi friends, thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi friends, welcome back to the Concussion Coach podcast. Before I introduce my guest today, I just wanted to make sure that you are aware of the free guide that is available on my website. It's the 5 best ways to support your loved one dealing with a concussion. If you have a friend or a family member who is struggling with post-concussion symptoms, or if you're the one struggling and would like your loved ones to know more about what you're going through and how they can help, head over to my website, theconcussioncoach.com, and download the free guide. I am thrilled today to get to chat with Dr. Alicia Reiser, to whom I was introduced by Megan Schneider, who I interviewed on episode 123. That was a great interview. You should definitely check it out. And I'm going to give you a little intro of Dr. Reiser. With over 24 years of experience, Alicia Reiser brings a depth of clinical experience, education, and research that truly sets Arise Above apart in the Lehigh Valley of Pennsylvania. Dr. Reiser earned her bachelor's degree from Muhlenberg College and her master's degree from Misericordia University before completing her clinical doctorate at Salus University, Drexel University, Elkins Park, specializing in vision remediation. In addition to her clinical work, Dr. Reiser is an active scholar contributing to the evolving evidence base in occupational therapy and vision rehabilitation. She has published peer-reviewed journal articles examining concussion-related vision disorder occupational therapy practice patterns and occupational therapy curricula addressing acquired brain injury-related vision disorders. She has also served as a capstone mentor and secondary author on research exploring expert practice patterns and guidelines for evaluating pediatric concussion-related vision disorders, and co-authored 2 chapters in Understanding and Managing Vision Deficits, a guide for occupational therapists by Dr. Mitchell Scheiman, OD. Her work bridges neurological rehabilitation, vision remediation, concussion recovery, ADHD care, trauma-informed practice, and autonomic nervous system regulation, combining science, compassion, and innovation in a way few practices can. In addition to leading Arise Above, Dr. Reiser serves as an adjunct faculty member in Drexel University's OTD program, collaborates with AOTA to advance vision remediation practice nationally, and co-owns NeurOT Consulting. Sorry, is that NeurOT? That's how you say it? Consulting to train other providers in the holistic mindset that defines her practice. NeurOT, thank you. I was like, I'm not sure I'm saying that right. NeurOT Consulting to train other providers in the holistic mindset that defines her practice. What a wealth of experience you are. I'm so excited to have this conversation and have you bring your wisdom and knowledge to us. So thank you for being here. I appreciate it.
Well, thank you for having me.
Yes. Okay, so let me just start out by having you tell us about what led you to this amazing career that you've had. How did you get into occupational therapy? What made you interested in it? And like, how did it lead you to your current focus of practice?
Yeah, so I actually started at Muhlenberg. I was actually pre-med. I loved biology. That I just kind of loved that field. I was fairly good at math, but then I got into organic chemistry and I said, this is not for me and I'm not going to pass my MCAT. So that field and desire quickly changed. And I actually then, when I was done at Muhlenberg, I had applied to PT school because I thought that I wanted to help people in the allied health profession. My mom was a nurse. And so I had been in a nursing home and around the geriatric population since I was like 6. I would go in and I would help the recreation department. And I just remember she had this one special patient. He was a dense MCA stroke. And so she always had this connection with him. And that was probably the start of my love for the neurologic population. When I first started my career so I applied to PT school, and I didn't get in. And so in the meantime, I was a rehab aide And I got introduced to the field of OT, and I said, well, what is this? Because this seems to be more up my alley, just with the functional aspect of it. I just thought it kind of changed a little bit more. It was a little bit more dynamic for how my brain worked, and kind of said, well, maybe I should try OT school. So I applied to OT school, and I didn't get in again. And so I was like, this is not really happening. I need to make a career choice here. And with that, it was August, and Misericordia had called and they said, we have a few more openings. We just want to do the interview with you to kind of see if this is a good fit, because sometimes grades and that sort of thing don't really reflect who you are as a person or what you'll be like as a clinician. And so I went for my interview and I got into OT school. And 2 weeks later, I was starting on a weekend master's program for
Oh my
OT.
goodness.
So that was the start of how I got into OT. Um, and so it was the best choice that I ever made. Um, I just love what I do, and I love helping others, and I love the way that I can help others.
That's beautiful. Yes, it's funny sometimes how doors close and we're like, what the heck? That's where I supposed to be going. And then it leads us to another door that is the exact right thing for us. So that's cool to see that play out for you. So then yeah, once you were in OT, what brought you to doing the neurological specific concussion kind of population?
I started out like I said, I had my favorite clinical was actually in mental health. I wound up doing a 6 week rotation in inpatient and a 6 week outpatient, and just having in college having some kind of struggles with depression and anxiety and that sort of thing. I really found it to be helpful, and I loved how OT had such a wide range of how we could help people, and so I took that experience of the psychosocial piece of OT, and I always, no matter what discipline or what setting I should say I went into, I always kind of took those tricks and tips that I used with me. And so I started out in a nursing home, just kind of back to when I was 6, working in that environment. And I love my geriatrics, and I still love my geriatrics. But in a skilled nursing facility, it's a lot of Parkinson's, it's a lot of stroke. And so that's where I kind of started an interest there. I had transitioned then to transitional skilled unit or subacute, and again, more strokes. And I wound up stumbling across my mentor in OT, and he really had a strong affinity for vision. And so I started to learn about like eye teaming and the brain processing, things that we always kind of learn in OT school, in terms of like visual field cut and how to compensate. Um, and so I transitioned then from subacute to outpatient. And that's really when concussion was starting to come to the forefront. Like, you're not just putting people in dark rooms and hoping that they'll be better in 2 weeks and sending them back out into the world. And that was
Mhm.
really when they said, no, you can actually rehab it. You don't want to do cocoon therapy. You want to do more exposure therapy, gradual to tolerant kind of things. And so I started to do more concussion rehab, and again was applying what I had known about vision to my skill set, but always felt that there was something missing. And so at 17 years, I was like, something's wrong here. Like I'm still, there's a missing piece. And I knew to kind of refer to optometry, because they are the ones who really deal with that eye-brain connection versus ophthalmology, who's more medical, eye integrity, glaucoma, cataracts, those kinds of things, macular degeneration. Um, and so I was like, but there weren't any around. There weren't any local optometrists who did vision therapy. So I was stuck with these people who I would like rehab them to 75% after a concussion, but their biggest thing was headaches and eye strain and nausea and dizziness. And I was like, this is not, I'm helping, but I'm not getting them back to work. I'm not getting them back to school. They're still struggling. And with that, I had gotten in the mail a postcard for the program that is at that time was at Salus University, which really was part of the Philadelphia College of Optometry. And they were just launching an OT program for their clinical doctorate that had a vision remediation track that was being taught by an optometrist. And I said, I kind of always wanted to maybe go back to teaching, as I got older in my career. And so I said, this is interesting. And so he was actually local here in the Lehigh Valley doing a pediatric course. And I don't treat pediatrics, but I was like, pediatrics is neurodevelopmental. And so I was like, which kind of applies. The brain is brain. It doesn't matter if you're older or younger. So
So true.
I took the course. And with that, he was then talking about his new clinical doctorate program that they were starting. And he was saying that he understands how OTs work because his wife was an OT, and my mom had just passed away in March. And in April was when I took the course. And he was talking about his wife, and he was saying, my wife, Maxine. And with that, I'm a very big sign person. My mom's name was Maxine. And so I was like, she's trying to tell me something here. She's trying to get my attention. And so I said, I think I'm going to do this. I'm going to go back after 18 years for my clinical doctorate. And 18 months later, I had that doctorate with a focus on vision remediation. And so really learning about how the interprofessional model of OT and optometry working together, how we can look at it from the sensory end, and how, you know, if they give us the diagnosis, but don't have the means to treat the patient, as now that we're skilled and trained under that doctorate, that we can help, and integrate the OT, the cognitive piece, into the concussion population, the sensory regulation piece, as well as the visual piece, because that is a strong sensory system where we get most of our information that is highly, highly impacted with concussion.
Yes. Oh my goodness. Thank you for sharing all of that. It's it is such a key piece that is not always addressed. So I love that yeah, you're bringing this up. We're talking about this. So at what point did you open your own practice then? Was it after you got your OTD?
It is, yeah. And so I got that, and I had worked for network hospitals in an outpatient setting, and there weren't optometrists in the network either who identified, the visual piece to the injury. Sports med was kind of fighting with neurology because they only wanted the athlete concussions. Neurology, had the slips and falls, or the workers' comps, or the auto accidents. And so it just wasn't a cohesive model. So I said, I want to do this so that it's not just treating eyeballs, or just treating memory, or just treating, return to sport. I wanted to make it holistic and comprehensive so that we were actually treating the whole person. So I decided to take the leap of faith. I was fortunate enough to have a friend who had her PT practice, and she, welcomed me to join her PT practice at that time. And so we worked side by side. Her ultimate goal was not to treat primarily concussion, where I was starting to get more of a following, where I was being referred primarily concussion. And so we
Mm,
decided to split ways. And then I was fully on my own as of like 4.5 years ago. So it's been 8 years, so that's exciting.
that
Um,
is amazing.
and just really drawing in still a lot of brain-based clientele, mostly concussion, but also a lot of ADHD and high-level autism spectrum
Mm.
folks, because knowing the correlation to learning-related vision disorders with them as well.
Mm. And that is actually, I think, a really interesting and important point. So let's talk about that for a second with the ADHD and high level autism
Sure.
populations. What have you like, how did that start coming about? Like, were you just like, hey, let's see if this works for these guys as well? Or how did you start working with clients who had those diagnoses, and what have you seen be beneficial for them?
Sure. So when I was in my going back to my doctorate, I had to test people, right? So who's the best people to test but your family members? Um, and so my oldest is on the autism spectrum, and then my youngest has ADHD. And so I noticed that when I was testing them, their their eye skills were not great. And so just kind of kept that in the back burner. Still didn't try to do therapy with them, which again, I'm like, you probably should have started way back then, but did not do that. Went on to open the practice, and then, um, and then as they got older, and my oldest was starting to transition into higher level kind of transitioning life skills, deciding, am I going to go to college? Am I going to go into the workforce? Um, I noticed again another gap in treatment where I didn't know he didn't need little kid OT, but he definitely didn't have the executive functioning skills um, to use to help him. That was my biggest fear, was that he'd get out on his own and he wouldn't, have the time management. He wouldn't have the task initiation. He wouldn't have, the response inhibition, all of those things that kind of come. So, um, long story short is that I was like, there's this gap and I want to kind of do this transitional life skills also within our clinic. And so that's what we kind of opened the door to. So that invited a lot of high level autism spectrum, ADHD, kinds of clients. And then we always do a sensory screen, right? Because this is very much a part of who these people are. It's also very much a part of who gets impacted by concussion, that sensory system, that overwhelm, that, hypersensitivity to light, to sound, to those kinds of things. And so it was like a perfect match because they were presenting very similarly. And so we would test all of these neurodivergent folks, and I'm not lying that every single one of them had a visual inefficiency. And so it kind of is almost like a chicken or an egg kind of scenario where, do they have ADHD and so they can't fixate and attend to near things because it's blurry, because it's double? Like, who wants to look at something that's near and double?
Mm.
Or because they have a visual inefficiency, has that developed into an inattentiveness and a behavioral problem that is being now labeled as ADHD? So it's very comorbid, if you will, like
Mm-hmm.
they are very highly interrelated. To have eye issues or visual inefficiency issues when there's an ADHD diagnosis. So in relation to the concussion population, um, if you have ADHD and you are in high risk activity because you like the dopamine release and you're at risk for concussion, either through, sport or bike riding or any of those kinds of things, you possibly then are going to take longer to recover from your concussion because you're already not neurotypical, if you will, where your brain says, I'm going to process my visual information this way. You've already kind of probably cheated the system a little bit and compensated, with how much you can attend. Now you have an injury on top of that. And so now you have to find path 3. And so that's typically because our clinic will see those long-standing concussion patients who have tried other things and it hasn't really worked. Those are typically the patients that we see who have an additional comorbidity. So it kind of was a nice little bow on everything where we're really just treating the brain, and it doesn't matter if it's long COVID. It doesn't matter if it's a POTS, a dysautonomia. It doesn't matter if it's concussion, if it's ADHD, if it's autism spectrum. We're treating you as the person and you as the brain and how your brain feels safe in that environment so that we can get your vision to work for you and not just against you. Because when your brain does not feel safe, your visual system is going to go haywire.
Mm. Yes, yes, all of that is so awesome. I just so appreciate that perspective and everything that you just brought up there. I want to um I want to ask you about, well, for moms out there, moms and dads listening who are like, "Oh, my kid has ADHD and I haven't thought about the possibility of a vision issue being associated with that." Um have you found that as the vision improves, as you guys are able to work on that, that their attention improves?
We have, again, they can attend longer, so they can centrally fixate longer. And behaviors change, right? When all of a sudden, again, I go back to that example, who wants to look at something that's blurry and double all the time? Or especially with that transition, it may be clear at near, but it might be blurry at the board. So they're going to look like those daydreamers because the teacher's writing on the board. And they're just, it's blurry, so they're not going to copy it. And then when they transition now to their paper, it might be double now because their visual system isn't going well. So it's a lot of, if so many times I've had the mom in the room or the dad in the room, and I was like, do you see like 2 things? And they're like, yeah. And the parents like, you're seeing double? And they're like, yeah, doesn't everybody see double? And like you don't know when you're a kiddo what you don't know. It's supposed to be blurry. And I remember too, I felt horrible when my son first got glasses. He did the fifth grade nurse screen vision exam, and they're like, I think he needs glasses. So he went and he got glasses. And I remember on the ride home after we picked up the glasses, and he was like, that sign is clear. And I felt like the world's worst mother because, again, I never said, is it blurry? But how do you even explain blur? Like when they don't
Mhm.
understand what is sharp, what is crisp, what is, like, is it fuzzy? If they don't have the
Yes.
vocabulary either to understand that. And I think that's the biggest part too, like with concussion. And I know Megan and you talked about the interoception piece a lot. That gets shut off sometimes after trauma. So if you're not feeling that your eyes are pulling or you can't tell that you're crossing your eyes, that is the biggest problem after a concussion is that I can't tell if my eyes are looking far or if they're looking near. And so I can't tell how to fix the double vision because I don't know what to do with my eyes because they're not coordinating like they're supposed to. So again, if there's that comorbidity of ADHD where maybe they don't have that interoception again on top of that, and that awareness of their body signals, then it's going to be even a longer road for that recovery because their brain doesn't automatically know how to do that necessarily.
Yes. Okay. I'm so excited to just pick your brain on this and dive in. I love the things you're sharing. And I love the point you made about how kids don't know what they don't know. And it just kind of I was talking yesterday with somebody about how like emotionally we tend to like only want to feel positive emotions and not feel negative emotions, but in reality we can't know the positive without knowing the negative. Like you can't know that something is blurry if you don't know what the clear version of it is. Like you don't know the difference. And so little ones who are just like figuring out the world, it's all just like it's all just the way it is for them until they see something different. So I appreciate you bringing that part out. Um,
Exactly. And so, yeah. And so if no one drops like a lens in front of them to be like, this is clear, they're just going to think that the world is supposed to be fuzzy.
yes, yes, exactly. It's so crazy. So how is it that you address? I love that you are working with. I love what you said about working with the whole person with a brain, right? You're working with somebody's brain and and who they are and what their life experience is and what their interests are. Like I love OT because of this. It is so holistic, and individualized, right? But as you're doing that, and as you're treating brains in with whatever diagnoses they come in with, how like what does it look like if a client comes in? How does that like play out, and what makes your clinic's approach unique, I guess, in how you approach the treatment?
I think the first thing that makes us unique is that we all have our own brain, if you will, issues. So, some of us has had concussions. Like I've had two. One, neither one really diagnosed. So one, I diagnosed myself. The second one, I look back at I was like probably like 9, and I whacked my head on the corner of a bookcase, and I actually fractured my skull. Like I have a dent in my head, but I was 9. I didn't know what I didn't know. I can't remember if I had a headache, but I can't imagine with a skull fracture that something didn't happen. I know now as an adult that I have my own eye issues. Like I couldn't converge for a really long time.
Mm.
Looking at my father, he had an eye drift out and he always had a lazy eye and he would always read just like with one eye open. So there's a lot of comorbidities here. Again, I have 2 neurodivergent kids. So as perimenopause is hitting, I'm also like, what is going on with my own brain? So I think we all have stories. We have another gal who has had Bell's palsy, so she gets double vision. She's wearing prism. We've all we get it. And I think that's the biggest thing is that people really feel safe here, because we can experience with them when they're like, they'll give an example of something that's happening because of their concussion. And we're like, yeah, that happened to me too. And then this, and then you go off and they're like, wait, so you're not calling me crazy. You actually understand what I'm saying to you when I say this. And I'm like, yes, because either I've experienced it through one of the other clinicians or through other patients that have said the same thing. Unfortunately, I've had a patient who was actually put on schizophrenic meds because of how she was describing what she was seeing visually. They're like, oh, you're hallucinating. After she was in a rollover, they didn't put the two things together, didn't realize that it was that her brain and her eyes were not connecting. Obviously, she did not do well on the schizophrenic meds because she wasn't schizophrenic. And it took her 10 years for someone to finally hear her and listen to her. And then, she came to us and she's just so grateful because we've literally changed her life, but she's also very angry. And she's also very angry because for 10 years, no one recognized that this was what was going on with her. And she lost, her career. She was in med school. And now, she's like, I'm a call center person. Like, this is not where I'm supposed to be. And so we're really trying to, that's who I'm treating. I'm treating her, the person who wants to go back to med school, even at, 35. Like, you can do this, we can get you there. But it's just because she was so deserved, she wants to then give back and help other people. So I think that's what makes us special is we hear you. Megan has her support group that she leads. And so she's a huge proponent, obviously, with her own story. When you interviewed her, I'm sure she shared that. And so I don't know, I think that's just what makes us different. And we don't do the medical model. And if you're not getting better, we pivot. We don't just say, up, insurance didn't give you any more visits. We're done. We fight for our clients. And if we don't understand what's happening, we're all nerds and geeks and we go figure it out. We go and like try and find an article that might have that one random case study that kind of sounds similar to this person's story. And so I think that's really we really just try and strive to help you when you've probably felt lost and forgotten along the way.
I love that. And I appreciate the fact that you're able to provide that kind of care because you're doing this on your own, not in another kind of system where you're forced to do things a certain way. So I think that's amazing. And yeah, just so validating for people. And that piece is massive. Like I think for the fit, like even for physical recovery, to know that you're like to have that validation, to have people say, no, you're not crazy. This is real. Like you're actually experiencing this and your experience is valid. Like that just that alone can make such a difference for people. So I appreciate you sharing that, and I hope that people listening to this can feel that as well. Like it's really important. And so I love that you guys are providing that. And then I appreciate you sharing the experience of your client. That's a piece that we haven't talked about a lot on the podcast, but I think can be a very real and possibly inhibiting part of recovery for people, that of the anger from how the system didn't serve them initially, and like so happy that they found you, but yeah, there's a lot of lost time there. Or you can think of it that way. So there is that like psychosocial piece that is so real and important to address. And I love that she's, turning this and like taking that pain and that frustration and channeling it into something that's going to be positive and like making purpose and meaning behind it, that she'll be able to do good in the world with it. So a lot of things that you brought up. So thank you for all of that. And for what you guys are doing.
Sure.
It's so good. And and I actually just as I don't know, this is an aside maybe that hopefully some people listening will find this interesting and helpful, but I am curious how you do the insurance piece. Like as a private practice doing OT, you do take insurance. I assume you take private pay. Like how does it work?
It's a struggle, right? Because that's another soapbox for another day, how insurance just doesn't really give the provider what they're worth. And so I know in private practice, that's a huge topic, like I said, for another day, about how, especially therapists are trying to do the cash-based model and all of that. Unfortunately, the clientele that I treat, they're not working, right? They're out on injury. They have a concussion. So maybe it was a car accident, maybe it was workers' comp. And so they're not working. So they couldn't do private pay anyway. They couldn't afford it. So we kind of have to, obviously we do workers' comp and auto insurance, but We also do Medicare. We do commercial insurances, because otherwise people wouldn't be able to pay. I mean, even our private pay rate isn't crazy, but even sometimes they're like, I can't afford that. And in today's society, I get that. But then what's your alternative as well? Do you know what I mean?
Mhm.
If you can't work because of your concussion, but then you can't pay for the services that you need so that you can work. It's just so cyclical. And I always say the system is just so broken. And I don't have a way to fix it. I just wish everybody could get recognized for the care that they need, have it be diagnosed as a concussion right from the get-go. Understand that it's not necessarily going to heal in 7 to 10 days. And even if you don't have symptoms, and this is what I think is the biggest misnomer as well, especially for return to play kiddos, and adult athletes, I should say, is that even if you're symptom free at day 14, your neurotransmitters in your brain are not back up to baseline until day 28. It's twice as long. And so you're not fully healed at a neurotransmitter and brain energy and chemical level until twice as long as that you're symptom free. And so people who have been, out of work for months, like they're still not fully recovered because they still have to get those baseline chemicals back in their brain. So they're not in that energy crisis and they're not neurologically cascading and repeating this. But again, we all know that when you have a concussion, you're at more risk for another concussion because now a slight bump or jolt to the head or neck with whiplash is going to exacerbate symptoms again. It doesn't necessarily mean you're reconcussed, but it's not going to feel good. And so this
Mhm.
is a lot of our clientele too. They have depth perception issues. They don't see that the cabinet is here versus here. And so they're going to bump their head. They're not paying attention because they're trying to stay balanced when they get in the car. They're going to brush their head on the top of the door frame. And so these little injuries keep impacting, what is occurring in their life and their symptoms. And so that's the biggest thing with concussion rehab is it's a lot of ups and downs. And so they start to feel good. You're going to do more things and now you crash because you're overwhelmed and you're fatigued. And so that's one of the things that I tell people all the time that, it's not a linear whoop, I'm better. It's not like I broke my leg and today I'm, doing a leg extension at 5 pounds and then it's going to be 10 pounds and then it's going to be 30 pounds. It's not like that. It's you have to take in life stressors. So now, we deal with this a lot of times too. Patients come in, they were in a car accident, now they can't work. Now their fiance is like, I'm out. Like, you are not providing anything because you're so symptomatic. Like, I'm not, and you hate to say it that way, but I'm not getting any benefit out of you. You're miserable all the time. And so we're dealing with that part too. That's not going to make a person get better faster. That's going to make them spiral into a depression. And then now you have to treat that aspect of their concussion. And so I mean, these are the people that we're seeing all day long and trying to help those people who just, oh, insurance said 8 visits and you're done. You didn't progress. You plateaued. Sorry. That's the biggest struggle, I think, with insurance, is that no one is going to bat for these folks, but we try to here.
That's awesome. Yeah, it is. You just bring up all of the like very real issues that people are dealing with, like as a human, as a like emotionally, and also in the system that we're working in. And it is, there are things to be grateful for in the system. The fact that they're like people are working to help with things, but yeah, there is definitely room for improvement and help. So do you I don't know. Do you have any advice, any suggestions, or any like things that people, if they're
I
in
think you
that
just have to keep
situation?
advocating. Yeah, I think it's just really advocating for yourself, but with grace and understanding too, because some people also come in here and they're very assertive and aggressive. No one's hearing me. Okay, I am trying to hear you, but right now you're almost your own biggest enemy then too. So it's a very fine balance between provider and patient.
Mhm.
And certain treatment modalities and strategies and interventions are going to work really well, and some people just have to get out of their own way as well. So it's just really advocating for yourself, finding that right provider. It's a fine line too, because then you look like you're physician shopping, right? If someone isn't hearing you and you want to go to a different neurologist or to a different sports med guy or a different, concussion location, because the other one said you plateaued, you're in a sticky situation because it can look like that, especially based on the documentation. And again, that's a limit of the system as well, where, therapists can only write so much. We can't paint this huge picture when you've got all of those things that I just mentioned, a couple minutes ago. That's very hard to be productive and, according to those standards, and put it all in one little box on your note. And then, reach out to other providers to be like, all right, what are you doing for PT? What are you doing for speech? What are you doing for pain management? And trying to throw all those balls in the air, because sometimes that is what it takes. It takes acupuncture, it takes red light therapy, it takes all of those other things to get you out of that fight or flight system so that you can tolerate the therapy to improve. And I think, again, I would love for insurances to recognize that, vision remediation by optometry can be helpful. That red light therapy, that microcurrent, that those other modalities have benefit. And I know the evidence is coming out for that, but it's going to take time, and people don't have time.
Thank you for bringing all of those up. Yeah, it is important, and just the fact that we're talking about it, having it put out there, I think is important. So people have that on their radar. They can talk to their providers and, share things like this with them. So thank you for all of that. And we've touched on this, but I would love for you to share what you see. What does OT bring to the table in concussion recovery? If I know, again, I know we talked about some of those things, but is there anything that you want to make sure that we talk about as far as OT and concussion recovery?
Yeah, I think it's really, again, function, and treating the whole person. Um, with us bringing the vision remediation to AOTA, I think I've been a strong advocate of looking at the occupational therapy practice framework, version 4. I keep looking at it and I'm like, well, we can put vision in here and we can put vision in here. There's like 29 different items in the domain and practice of our practice framework, what we do as OTs that are in some way are related to vision. And it's looking at those body pieces and parts, the performance of those body pieces and parts. It's looking at the vestibular system, all of those sensory integrative aspects that we, especially as OTs, are known for. Like if we're not known for dressing, we're kind of known for sensory integration therapy, right? I think those are the two things that people think of possibly, when they think of OT. And so I think we can bring in all of those aspects. We bring in the function, the return to sport, the return to play. We work in the school system. We should be very well versed in what kind of accommodations kiddos either with concussions or with learning related vision disorders need. We're trying to either compensate or remediate so that they can be successful in whatever they want to do. Again, in our name is occupation. That means function. It doesn't mean your job, but everything we do is a job, I guess, if you want to put it in that way. And so, again, love that interoception is coming to the forefront, adding that to our sensory system based on the work from Kelly and from Megan, and really knowing that trauma and injury can shut that pathway off. And so now we have to start over again so that we can rebuild those pathways neurologically to say, oh, this is a pain response. This is an emotional response. I'm getting triggered and I'm just ignoring it. And now I've just yelled at my kids because I have a headache, but I was just trying to ignore the headache until I couldn't anymore. And so we understand that piece. We are trained in executive functioning and cognition. And so, a perfect person to talk to speech, we know the vestibular system as well. So we can talk PT and be like, hey, when you're working on VOR exercises, maybe try, adding this component to it that's a little bit more OT related, or on the visual end, they're not going to be able to look at their finger, move them back. So that plane of convergence is a little bit bigger. Again, whole person function, we can kind of help other disciplines in saying, hey, they talked to me about this. And I'm not telling you what to do, but can you maybe mix that into your programming so that, because obviously we can't do it all, and I'm not saying that we can do it all, but just that communication among all rehab team members and all providers is just so key. So I think that's something that all of us can do in any of the allied health professions is just talk to each other, reach out, communicate. But again, that takes time and in a system that's a little bit more time constrained, it's tough. It's definitely
Mhm.
tough.
It is tough, but I love that you bring that up and that it is so vital to have that interdisciplinary communication and teamwork. Like we can't just do siloed care. It doesn't work. The best care for our clients is that like, okay, let me work on this and you are working on this and let's talk to each other and figure out how to do that. And it just, I mean, whether it's concussion or anything, that's really the best way to help our people. So,
Yeah.
um, yeah. Thank you for bringing that up. And I know that you've been working on, we kind of brought this up, but the exciting things in relation to vision remediation and occupational therapy. For those who are listening who are not familiar with what vision remediation is, can you explain what it is and why it's important in concussion recovery?
Sure. So a lot of times what can happen after a concussion injury is that your eyeballs and your brain are not talking to each other. And so that can look like an ocular motor issue. So that might mean you're having trouble reading, your eyes are falling off the line, you have to go back and reread. So that's huge in school. Or you can't follow a moving object, which is more of a pursuit kind of issue. So sports is going to be hard. You can't catch a ball. You can't look at another car that's passing you at a stop sign, like at a four-way. That's going to maybe make you dizzy. So we look at that ocular motor issue. Then we look at the vergence system. So looking near, our eyes cross, and that makes us see single when the eyeballs meet in the same position in space. When we diverge, when we look far, they also need to meet in the same position in space. If that doesn't happen, we're going to get double vision or we're going to compensate our behavior and our body. So if our eyes are out of alignment up and down, we might then do a head tilt. So now my eyes can cross and meet in the same position. So that I can see single. But now I'm left with this head tilt. So that's not comfortable. So now we're going to have neck pain. Well, guess what? The nerves that operate the eye muscles come out of our neck. So now we're putting stretch and pressure on those cranial nerves, and that's going to impact how our eye moves. We also look at the focusing system. So think about when you go to take a picture on a camera, maybe you want to be artsy and take a picture of the background when there's a blur in the foreground. Well, that happens with our eyes too. And those two systems of eye muscles putting our eyes in the perfect position in space and our focusing system making things clear, those two work in a ratio and back and forth, and they are very interdependent upon each other. After a concussion, after an injury, there can be a lag in that system and there can be a disconnect. So you might have single vision, but it's blurry, or you might have clear vision, but it's double. And so what vision remediation looks at is how can we retrain that eye-brain connection so that they're working in a coordinated fashion again. The other things that can happen is there can be some visual perceptual issues. So now if things are in clutter, that might be very overwhelming. You might not be able to, rotate and figure out how certain puzzle pieces or your key goes into your door anymore, just because there's a little bit more of a disconnect there. And so we work at that visual information processing, spelling, visual memory. Those kinds of things might be impacted again after an injury. So we're not just trying to compensate. We're not saying just use a line ruler and your eyeballs will stay on the line. We're actually trying to do drills with you so that those eyes work better. Here's the thing though, you need to be as an OT specially trained. We can do ocular motor things, kind of functional near far board to table things because we're doing that in normal everyday life too. But when you do vision remediation, you're working with optometry. They have given you the diagnosis. They are maybe choosing not to perform the vision therapy and they want, they might say, I trust you. You have your advanced training in this. You are aware of how the sensory system is interacting both vision-wise, vestibularly, auditorily, balance-wise, and so will allow you to kind of take this vision system and work with it. And you can use lenses and prisms. So it's not for the entry-level OT to use those lenses and prisms. You really have to understand how that visual system works, and you have to have that open communication with optometry. Because again, there's still some things that they are the experts in vision, we are the experts in function. And again, this is where that interdisciplinary model really works well together. So what we have done is, after a bunch of us now have gone through this program at Salus, which is now Drexel, we are in little silos across the country. And my research for my capstone was, what are we doing as OTs? And it was very splintered and it was very scattered. And some people didn't even look at, near point of convergence. Where do they break? And so I had one of the comments in my survey was, eye issues after a concussion are very rare. And then I proceeded to follow up with, do you test for this, this, and this? That provider did not. So of course you don't have diabetes if I'm not doing a blood test. Do you know what I mean? Like, you're not going to have an eye efficiency issue if I'm not even looking at your eyeballs in the system. And so that is what led us all to kind of say, there are more of us. We don't want to treat in silos. We want to work with optometry. How can we make this happen? And so this past fall, I had a capstone student that kind of pulled all of our research together and kind of made a plea to AOTA in their special interest section that said, can we get a community of practice going that is all of us doing this vision remediation, which we're trying to change how the eyes and the brain are talking together so that the brain feels safe and that it can function and you can see single and you can see clear. Because we want to make sure that we are all doing the same thing. We want to know how to work with optometry. We want to treat the masses so that this kind of care is out there and it's not just in big cities. I mean, rural folks who, get in a car accident or might have, a farming injury, like they have to go hours to go get this kind of treatment when to find that specialized optometrist to give them the diagnosis, to give them the therapy if it's only done by optometry. So again, our main goal is not to step on toes. We want to work with all of the fields, so that we can help more people and have different lenses of how we're viewing the person. I don't mind if you want to use lenses and prisms so that they can cross and relax their eyes, but I would like to help you treat the rest of their sensory system so they can see both of us. They can see optometry and they can see occupational therapy at the same time. Or again, if you don't have the training or the means to do it, I'm willing to help you out. And so again, it's very much, you must be trained. You must know what you're doing. The visual system is very powerful and you're changing brains when you're doing this. But we just wanted to get AOTA behind us so that we could go to the Optometry Association as well and be like, hey, how can we make this just better for more concussed individuals, for more kiddos with learning related vision disorders, for more adults who are saying, I think I have ADHD and I can't stay on the line and I can't read and I can't, when I transition near to far, like that doesn't make sense to me either. And I just feel all squirrely all the time. We can help all of those people. There's enough to go around. And let's just use what each discipline knows the best of so that we can work together and just help each other. And so the co-op got passed. Long
It
story.
did.
It did. Yeah.
That's fantastic. Oh, it's such good news. And I'm like getting excited hearing you talk about this. I'm like, yes, we need this. This is so fantastic. Thank you for the work you and your students are doing. This is so
Yeah, and so
wonderful.
I mean, we had 100 people at the open house. The open house was the end of March. We were supposed to have our first meeting in April, but with AOTA month or OT month and conference in California this year at the end of April, they pushed our first meeting back to the end of May. So I think that Wednesday is the 27th. I don't want to misspeak, but it's whatever that last Wednesday is in May. That is our first meeting. So there is a survey link if you go onto AOTA, if you are an OT provider and a member. If you go onto the AOTA's website under the special interest section, you can see how to get the survey to join it's a long one, the occupation-based neuro remedial vision rehab community of practice.
There needs to be a really good acronym for that. That's a
I
really
know,
long
I
name.
tried to think, yeah, I know.
Um, and maybe we'll put the link for that in the show notes, so that if people are listening and want
Okay,
to
great.
just go to it, that would be great. But that is fantastic. And I'm curious, is it a virtual meeting or is it in person?
Yes, it's a virtual meeting. So once you sign up via the survey and become a member of that specific community of practice, they send you. Then there's like a discussion board, and then everybody can kind of talk back and forth. You can share articles. Our meetings are kind of again just to kind of see what everybody's doing out there, to maybe have that difficult case study. This is my patient.
Mhm.
What would you do? And that sort of thing. So it's really just to build that community, not to offer education. It's just to kind of, have us talk amongst ourselves to try and get a good a good support amongst us
Mhm.
as a profession as to what we can do.
I love it. That's fantastic. And yeah, thank you again for the work you're doing. And I'm curious if an OT is listening and is like, oh, I want to get some training in this. I want to get good at this so that I can provide help in this way. What would your recommendation be? Like, where should they look to get that kind of training?
There's a couple different places to look for like the holistic model. Megan and I do have a consulting business, the NeurOT Consulting. So, she does a lot on the interoceptive end and on the pediatric vision end. I do a lot on the concussion end. We kind of walk you through holistic interventions that we use. Um, I will just say this just came in the mail yesterday, and I'm going to do another little promo here for us. But Megan and I wrote this book. It's 100 visually loaded activities and occupations.
Hey,
And so
awesome.
it takes everyday activities. So like Simon Flash here. And it kind of gives you all the occupational performance components here, how to upgrade it, how to downgrade it, how to do it for pediatrics, how to do it for adults, um, and like how to actually do the activity. And so we just got our copy yesterday in the mail.
That's
So that's
fantastic.
exciting too.
Is it
So
available?
it is. So the pre-order, because we got like 50 rushed, but then the rest are coming over
Mhm.
um, a little bit later from now, but it should be soon. But there is a pre-order link on our NeurOT Consulting website that you can order, and that's where our modules are as well. There are other, PESI has some through Robert Constantine. As we're getting more out there, more of us from Salus, from Drexel are offering education, and some of it is more basic. Some of it is more intermediate. So I have taught at VisCon for 2 years, so that is through Chow seminars. And so they just had their third one this year. We just learned an amazing taping technique that Dr. Saxarud uses. He is an optometrist out. I'm going to misspeak. I think it's in Colorado. But basically, it is really just a way to make the brain feel safe
Hmm.
based on how they're posturing, if they're anterior or posterior, if they're lateral or, right or left. And then, we do some behavioral testing to kind of see how their body responds to certain things. You place the tape on and they react, and we've had amazing responses from that too. So VisCon through Chow is a good place for the more intermediate level
Mm.
vision person. Um, and so, yeah, those are kind of like the three places that I would kind of look for if you're looking to entertain working with vision in your practice.
Okay, that's very helpful. Thank you. How do you spell chow?
CIAO.
Okay, that kind of chow. I was
Yeah,
like, what are
like
we talking about here? Okay, cool. Excellent. All right, well, this is fantastic. I love that you're sharing this. I love the work that you're doing. I love that we're bringing this together and getting word out there about this. I think it's so important and a really key aspect of recovery that, again, gets missed a lot of times, and but makes a huge difference. So I love this collaboration between OT and neuro-optometry. It's good. It's very, very good. Um, I always like to ask my guests if they can share an actionable tip that our audience can apply in their daily life after listening to this conversation. So, and since your focus is in on vision, I don't know if that you want to like give us a tip around that or something that somebody could try today if they want to like help calm their nervous system, if they just something that they should think about or look into or experiment with.
Yeah, I think the first thing is to know your eye care provider. I think a lot of people will go to ophthalmology and they'll be given, oh, your vision is 20/20. And then they'll settle for that. But they might still know that they're getting headaches and that sort of thing from their visual system, or they might still be getting double and they might still be getting blurry. So know your eye care provider. Because if you go to a neuro-optometrist, they are going to be the ones who are going to diagnose that brain-eye connection. So that convergence insufficiency, that accommodative dysfunction, that ocular motor dysfunction that I was talking about, that we address in the vision remediation. So I guess know your eye care provider and trust yourself. If you feel it's still coming from your eyes, even though they're saying you have 20/20 vision, advocate for yourself and try and find that. The College of Vision Development, covd.org. I think that is still their website name, but they've changed their title. But if you are looking for someone who is local to you that knows how to diagnose and do a full binocular exam, that is a great place to start so that you can at least get yourself to the right kind of provider who can recognize those kinds of dysfunctions. So that would be step number one, is to, try and find the right person to diagnose you if you feel it is a vision related issue. The other thing I think is just give yourself grace. Like I said, it is a roller coaster kind of recovery. And so it's hard to know, when do you push through or when do you hold back? And it's dynamic. Again, we're changing brains. And so there are going to be days where you're going to feel awful, and allow that to happen. But then there's days, hopefully, as you start to recover, that you will start to feel much better. And know that even though, like I said, it's not a total upward linear progression, as long as we're putting one step in front of the other, allow yourself to have, moments of success, even if they're little. I think that's the hardest thing, is to kind of be like, well, I'm not back to work yet. Yes, but did you read for 7 minutes versus 3 minutes? And I know sometimes it's that little, and a lot of times when we do our re-evals, that's when people are like, oh, I forgot that was even happening. Yeah, that's gone. And those are the little mini wins that we have. So allow yourself to celebrate those as much as, not kind of always just worry about the big picture. Sometimes the little picture is just as important.
Yes, amen. That is really beautiful and important advice. Thank you. And I think you touched on this. Is there any other specific advice around dealing with setbacks? If somebody's like, I've made progress and now I'm on the down slope instead, like I'm trying to get up and I'm finding myself going down a little bit. How do you consult with them or bring them hope in those moments?
I think, again, as OTs, we're great at activity analysis. So it's really being like, all right, so what happened yesterday, or what happened 2 days ago? And just being like, were you out at your kid's soccer game and it was freezing cold? So now you're like, your muscles were up here and you were shivering, and but you were out there for 2 hours and it was raining and cold. And then you had to go grocery shopping, and then you had to have Easter. Do you know what I mean? It's all of those
Right.
things. But you made it, right? So maybe, is that why you're feeling a little bit worse for the wear today? I mean, just have those discussions with your provider too. Be like, I feel like I'm plateauing. How can we mix this up? You know you best. Your provider, again, as long as they can only ask so many questions, and if you're not providing feedback to them, it's hard for them to use that crystal ball. So just advocate for yourself, but be truthful and honest with yourself, and ask them to kind of look back on the last couple of days with you and just be like, what could I have done that maybe I overdid it, that I don't realize I overdid it.
Mhm.
A lot of times I'm saying people are feeling good, and then I'm like, well, that's why you crashed on day three, because you had two amazing days. Like, again, give yourself that grace so that you can be
Mhm.
like, all right, I know I know this is going to happen,
Yeah.
but it
And
will
it's
take
part of the
time.
process. And I think
Mhm.
that that perspective of just like, um, you've seen this, you've seen a lot of people who have dealt with this, and you know that, yeah, it's part of the process. Trust the process. Like you still do the things that you can do when you can, give yourself grace when you can't. Like that's how the recovery happens. And so I think that perspective from someone who's seen it work over and over and over again can hopefully be helpful and hopeful for people just
Yeah,
to know that it does, recovery is possible, and this is part, like bad days are part of it, and that's
right.
just how it is. So yeah, I appreciate that. And I wanted to throw out there too, I appreciate you bringing up the covd.org, where you can find a neuro-optometrist, and I always tell people to click the little box that says board certified in vision therapy. I'm pretty sure that's what the box says, for when you're trying to find a local practitioner. So that's we'll put a link to that in the website as well. Okay. Oh, and I always like to have people share as well. What advice do you have for the moms, the dads, the sisters, the children, the people who are loving and caring for and trying to help out with their loved one who's dealing with this?
For as much as the survivor has to give themselves grace, I think the family has to give grace too. I know it's so frustrating. Everyone's going through the grief process, right? The
Hmm.
person who has the injury has gone through the grieving process and their loss of self and who they think and want to be again. And especially for spouses, I know it is so very frustrating because you're used to, your spouse either doing it all or supporting you here or being able to go, and now they have to like take a nap, and they never took a nap. I think it's just understanding that they're going to have good days and bad days. Like, how come you were so good yesterday and today you're a lump on the couch? I think it's very you know, you have to give them grace as well. I think for parents, it's super hard because, again, you don't know the questions to ask. They don't know how to describe a headache, and then a headache is like an eight. They don't know how to give a 10-point scale on, and they can't feel that gradual. It's either I have a headache or I don't. My eyes hurt or they don't. So again, it's for parents too, it's advocating with the school systems because sometimes the school systems think that the kids are just playing the system so they don't have to do the work, or kids are gonna sandbag tests and that kind of stuff so that when they do get tested on the impact they'll look better. I think when they are injured, so like they'll have a lower score on purpose so that when they get
Mhm.
injured it doesn't look like they have a concussion, and that
Mhm.
sort of thing, so that they can return to play faster. I think, advocating for IEPs for 504s can be a struggle for parents, but if you know that your child is really struggling, you're going to have to go to battle sometimes with the school systems who aren't as aware of the implications of a concussion and how they can impact learning. So,
Mm. Yeah, and that just brings up again the strong need for getting awareness out there, because there are so many systems that I think are trying to do their best to help people, and if they don't understand that this actually is a real injury and the way that impacts people, again, when I first started working in this space, I was like, wait, what? A concussion can do that? Like
yeah.
I did not know until I saw it and I was educated and I talked to people. So that's again part of the passion that drives this podcast is I want people to know that it's real, and that, yeah, like the teachers out there, or the school administrators, or the work, the boss at work, like people, if they understand, a little bit of understanding goes a really long way in just that, giving grace, giving compassion, and offering help in the way that is actually helpful for people. So I just, yeah, appreciate you bringing all of that up. And it's good advice. So thank you so much. Is there anything else you want people to know about concussion recovery, what you do, anything that we haven't touched on yet?
Um, no, I think we kind of touched everything again. My business is Arise Above OT, or Arise Above Occupational Therapy Services. Megan and I have the consulting business, which is NeurOT Consulting. And so again, we're just trying to advocate and help as many people. You can't help everybody, right? So even if we can help other providers help their clientele
Yes.
and their people, that is really our main goal. And just we're just trying to get awareness out there. Again, if you're an OT, AOTA member and an OT provider, check us out at the Community of Practice for neurovision remediation. The vote for the Representative Assembly, I also made a motion for a position paper to be written on OT's role in vision remediation. So the vote for that is April 15th. So we'll know more on that soon. So it looks like it's going to pass. So that's going to
Fantastic.
be a whole new step forward in terms of us working with optometry, I think, as well. So just stay tuned to Everything Vision and you'll find out some information going forward on that.
I love it. That's fantastic. Thank you. And just curious, are people, I'm guessing people who see you need to be local, or can you work with people outside of Pennsylvania?
Um, Right now, just Pennsylvania is not one of the OT compact states yet. So that means that we can't get our licenses reciprocated in other states. But it
Mhm.
doesn't mean that once that doesn't pass, I think we're close to that happening. And then we can kind of do some telehealth, especially on the interoception end, and
Mhm.
the executive functioning and the cog end. Vision is a little bit hard to
Yeah.
do over telehealth, but we've done it. And so right now we're just in Pennsylvania. Um, so even if you're out west, we're on the eastern portion. So even if you're out west, we can still see you via telehealth, but mostly local in person
Mhm.
in the Lehigh Valley. But we have
Okay.
people travel pretty far. We have people come from Scranton, from down Philly, from New York. We've had people come. So
Yeah, awesome. Yeah, so people from outside of the state can come to you. You just can't practice with them if they are outside of state. So I just want to make
correct.
sure that's clear for people. So,
Yep, yep.
fantastic. Well, thank you so much for what you're doing in this space, and not only for your clients and their families, but also for the OT community at large, and helping get that collaboration going with ophthalmology. I love what you're doing and really appreciate it. And thanks for being here.
Thanks for having me. It was fun.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.